More than 90% of doctors in the U.S. report that their patients have had their care delayed because they have to wait on an insurance company to approve it. This is according to a story by the American Medical Association.
Yeah, well, now one California lawmaker is trying to make it easier for patients to get the life-saving care they need. This is really shocking. On Your Side's Christine Lazar joins us to explain.
Yeah, you know, we initially did a story, if you guys remember, about a single mom who was waiting on a surgery, and her insurance company initially denied it. We got involved, she got the surgery, but it really struck a chord with a lot of our viewers, and we really wanted to look at the issue at large. And in doing so, I realized there's a bill that's in Sacramento right now, and it's going to be voted on soon, that would tackle this issue. Now, insurance companies typically require prior authorization for surgery, treatment, even medication. And earlier this summer, as I mentioned, we introduced you to a single mother with stage 4 cancer who was denied a life-extending surgery during that prior authorization process. Now, critics say it's a prime example of why this process needs to be reformed.
I love you, baby.
Just weeks ago, Roxanne Inoria wasn't sure she would be well enough to soak in moments like these with her 13-year-old daughter, Anella. But today,
I'm 2/3 cancer-free.
As we first told you last month, doctors at City of Hope performed a successful life-extending surgery to stop the spread of Roxanne's stage 4 colorectal cancer. Without it, her doctors told us the single mother would have just months to live. Despite this, her insurance denied the operation, saying it wasn't medically necessary. But with our help, City of Hope agreed to do the surgery for free, something the hospital typically reserves for those with no insurance.
So here I am, I have insurance, and they're using it for me. So in my heart, I felt like, that's not right. Like, they can't just get away with stuff like this.
Patients are not getting the treatments they need. It's delaying their health care.
State Senator Nancy Skinner recently introduced SB 598, a bill that would allow doctors who have a proven track record, at least 90% of the time, of recommending appropriate treatments to skip the prior authorization process.
What we've seen is that most doctors meet that threshold. And so the waste of time that the doctor has to go through in their office, all the paperwork, all the delay, not only is that delay costly, it hurts our patients.
Ocean McIntyre of Pacoima is one of those patients. She was left with permanent eye damage in 2007 when her health insurance denied immediate treatment.
I had lost more than 90% of my vision. I couldn't see distinguished colors anymore. I needed help getting around everything.
McIntyre testified in Sacramento in support of SB 598. Her eyesight is so poor now she had to change careers, she can't drive, or provide for some of her daughter's most basic needs.
The things that I loved were gone, a lot of those things.
Orange County pediatrician Dr. Eric Ball says every day he loses hours that could be spent with patients on paperwork for prior authorizations.
Prior authorizations, in my opinion, are a scheme that insurance companies use to make more profits by delaying care and by standing between me and my patients and what they need to get them healthy.
But insurance companies say the process is critical to prevent waste, fraud, and unnecessary medical procedures.
Many health plans and insurers are currently implementing their own enhanced prior authorization programs to help ease the burden on providers and enrollees. Unfortunately, the one-size-fits-all mandate that is outlined in SB 598 will disrupt those efforts.
The bill has passed the Senate and is currently in the House.
Do you think that you can get support from both sides of the aisle for this?
So far, I have definitely received support from both sides of the aisle.
As for Roxanne, after she got home from the hospital, she received this letter. The Department of Managed Health Care, which regulates insurers, overturned Anthem's decision to deny her operation. It was vindication, but she worries how many people like her simply give up.
I think that's what I think about the most.
Now, SB 598 also allows for doctors to have their appeals reviewed by doctors in the same specialty. In Roxanne's case, her appeal for a cancer-related surgery was reviewed by an ear, nose, and throat doctor.
Wow.
Another thing that's very frustrating to these doctors, they feel like if they're asking for a treatment, it should be reviewed by someone in that same specialty so they can understand. You know, it's
well,
like
you wouldn't go to a heart doctor if you have colon cancer,
Right,
right? Like
right.
you just wouldn't do that.
Exactly. And remember, these doctors have to have a proven track record. They have to have a year where at least 90% of their requests for care for their patients to go through, which means that they're doing it, conscientiously, that they're picking out the right treatments, and then they get a year of not having to do those. And, I think we can all relate to trying to get into the doctor and we can't get an appointment for weeks at a time. Right. And we tend to get frustrated with the doctor's office. Well, look, they're spending 2 days a week trying to get prior authorization for their current patients. Right. Imagine if we could take some of that out. Now, the insurance companies obviously say we don't want the Wild West, but the state senator said that's why they have to have that proven track record. We're not just getting rid of them. We're just saying for those doctors who are very precise and very good at what they do, they should be rewarded with this ability to not have to do all that paperwork.
Well, what really hit home in the story for me was the doctor saying, it's now getting between me and my patients.
Right.
And we all trust our doctor to do right by us. So it's
right. And if you trust your doctor, then they know what care you need.
Exactly.
Yeah.
Great to see SB 598 getting support.
By the way, voted on September 1st in the Assembly, so we'll keep you posted.
Wonderful.
Christine, thank you.
Thanks, Christine.